Hello, beautiful people. As you can see from my screen, Dr. HMS just had her second dose of the COVID-19 vaccine. Yes. So for all the newcomers, you're welcome to subscribe to my channel, the Medical Information Channel. Like, share, comment below in the comment section, and let's get to it. So on March the 5th, 2021, the vaccination of Nigerian citizens against COVID-19 commenced. This was following the delivery of about 4 million doses of the Oxford Astrazeneca COVID-19 vaccines to the country. This was done through the WHO, the World Health Organization's COVID-19 Vaccines Global Access Facility, otherwise known as COVAX. So being a frontline healthcare worker, and of course, as a result, being a first responder to patients, and also being at high risk of being exposed to the SARS-CoV-2 virus, I took my first dose of the Oxford Astrazeneca COVID-19 vaccine, otherwise codenamed as AZD1222. I took it along with my other colleagues at work. As soon as it was available, you can imagine everybody rushed to get it. So what do we know about this vaccine? The efficacy of the AstraZeneca Oxford COVID-19 vaccine is about 76% at preventing symptomatic COVID-19, beginning at 22 days following the first dose and about 81.3% after the second dose is given. The recommended regimen at that time, when the first dose was administered, was 2 doses to be given IM, that is intramuscularly, to the tune of 0.5 milliliters each, and with a recommended interval of 8 to 12 weeks. Subsequently, however, the federal government of Nigeria in early May 2021 had given the green light for the commencement of administering of the second dose of the Oxford AstraZeneca COVID-19 vaccines on eligible Nigerians who had received the first shots. So what happened was that the eligibility period between the first and second doses of the vaccine had been expanded. It had been expanded from 12 weeks to being able to take the vaccine from between 6 to 12 weeks after the initial first dose. This was in line with the scientific recommendations of the WHO, specifically the WHO's Strategic Advisory Group of Experts, otherwise known as SAGE, on immunization. So some of you might ask, why did I need to have 2 doses of the vaccine? And indeed, why do people need to have 2 doses of the Oxford AstraZeneca COVID-19 vaccine and most other COVID-19 vaccines? So having the second dose is actually essential to ensuring the best effect of the vaccine, and in particular to maximize protection against the new variants. I'm sure you're all aware of all the various variants that have been flying all over the world since the discovery of the SARS-CoV-2 virus. So as a result of this, getting the second dose as soon as it was offered was imperative, really. We also know that having 2 doses leads to a better immune response from your body, and also a longer lasting protection against the virus. It is thus important that everyone, and I mean everybody, gets these 2 doses. Even though currently ongoing additional research is still being undertaken in order to determine the long-term potential effects of being given a single dose, we should, in the meantime, take our 2 doses. So you may also ask, how efficacious really is the AstraZeneca AZD1222 vaccine? The AZ1222 vaccine against COVID-19 has an efficacy of about 63.09% against symptomatic SARS-CoV-2 infection. In published text, it has been found out that actually longer dose intervals of within the 8 to 12 week range are associated with a greater vaccine efficacy. You may also ask, does the second dose of the COVID-19 Oxford Astrazeneca vaccine, and of course, most other COVID-19 vaccines, do they have the same risks as the first dose that have been administered in the past? Yes, we all know that, after our first dose of the COVID-19 vaccines, many of us had a few side effects. Some people had major side effects, some people had minor side effects. But the greater part of the population actually had minor side effects, like chills, headaches, tiredness, pain at the injection site itself, after either the first or the second dose. Some people ask, are there any specific side effects of the AstraZeneca, second dose specifically? So apart from the previously mentioned side effects, the Oxford Astrazeneca vaccines actually give side effects which tend to be milder when one is given the second dose of the vaccine. And some of you may have experienced these side effects that have lasted for about a day or two. And some, like me, actually, I had the effects which lasted about 5 days for me. I had the pain, the discomfort in my arm where I had the injections. I had a mild headache, and I had chills and real rigors. Some other people who took the COVID-19 AstraZeneca COVID-19 vaccine also had some severe headaches, general feeling of overwhelm. So I mean, it may vary, varies from person to person how almost all the COVID-19 vaccines. And it is pertinent to note that not everybody gets side effects from them, really. Some people, some of my colleagues actually didn't have any side effects at all from administration of either the first or the second dose. And as I mentioned before, the side effects from the second dose are actually less common than from the first dose, and are usually gone within days. For me, I didn't have any side effects after the second dose, which just goes to prove that, yes, being given the second dose actually does give lesser side effects. So as I mentioned before, serious side effects are actually very, very rare, although they may occur. People have asked the world over, my getting this vaccine, is it safe for me? Is it safe for my family to get these vaccines? Is it safe for people generally to get these vaccines? So as at today, the AstraZeneca vaccine is safe and effective at protecting people from the extremely serious risks of COVID-19 virus. So, I mean, wouldn't you want to take the vaccine that would prevent you from having all those terrible symptoms and signs of COVID-19 vaccines? We know that some people have died. We know some people have been hospitalized because of the severe side effects of this disease. So wouldn't you want to protect yourself and your loved ones by taking this vaccine? Yes, concerns. There are always concerns with any medication that has been, especially, any vaccine, any medication really that is new, as we're all aware. As at today, the AstraZeneca vaccine is safe and effective at protecting people from the extremely serious risks of COVID-19. I will reiterate this. The WHO, the World Health Organization's Global Advisory Committee on Vaccine Safety on AstraZeneca COVID-19 vaccine, which covers reports of very rare side effects, has studied this extensively. Some of you may ask, what is the risk of getting a blood clot after my second dose of the Oxford Astrazeneca vaccine? Because yes, there have been concerns of getting blood clots following administration of the vaccine. So extremely low. When you read the data that has been published, extremely low. Millions of people have now received a second dose of the AstraZeneca vaccine, and to date, there have only been a very small number of cases reported of the very rare reaction of a specific type of blood clot in the brain, which is accompanied with a low platelet count after the second dose. So what do we know about the Oxford Astrazeneca vaccine? What do we know about its role in preventing infection and transmission? We know that there is still a small chance you might still get COVID-19 after the vaccination. However, even if you do get COVID-19, being vaccinated can reduce how serious your symptoms will be. Proven fact. No substantive data are available related to the impact of AZD1222 on transmission of viral shedding. In the meantime, we must maintain and strengthen public health measures that work. So we all know about our masking, our physical distancing, our hand washing procedures, our respiratory and cough hygiene, coughing into our elbows, avoiding crowds, especially when we have infections, upper respiratory tract infections, ensuring good ventilation among our homes and the likes. We should still do all these. So I hope you enjoyed this presentation. I would like all of you to please go and get your second dose of the COVID-19 vaccine if you've not already gotten it. Subscribe to the Medical Information channel. Give me send comments below in the comment section. Let me know what other topics you'd like me to discuss. Like the presentations, share them to your friends, to all your networks and family. And I look forward to seeing you again next time.